I am Dr. Alim Akhtar Bhuiyan. I am Senior Consultant and Coordinator of the Department of Neurology. I am working currently at Evercare Hospital. Actually, this is the uh, Apollo Hospital which was earlier. Today I will be discussing on neck pain. Neck pain is a very important neurological symptom, and lot of people are affected by neck pain, and it actually affects mostly people who are above 50, and it also can affect younger people, which is not as common. There are so many reasons for neck pain. I will elaborate shortly on the details of neck pain. First, today I will be discussing on the anatomical aspect of neck pain. Let's move to our discussion. So you can see this is our neck area, and this is our head. This is the rest of the body, and actually the neck connects the head with the rest of the body, and it is very important structure, and so many things are in the neck. If you see the yellow areas, these are the nerves which comes from the neck and goes to the upper extremities or arms. And you can have, this is the trachea, back you have the esophagus, the blue and red are the arteries and veins, and you have the cervical spine in the back, and the nerve comes out from the cervical spine. I'll go into detail on that. So actually these yellowish nerves, they come from the spinal cord through holes in the spine, and they go through the axilla. This is the axilla. It forms a plexus or network, and it goes into the arm. So this is the arm, this is the forearm, you can see the wrist joint, you can see the elbow, and these are the fingers of the hands. So the blue and red, these are the blood vessels. Here also blue and red you can see, and the nerves, the motor nerves, they control the strength of the muscles of the arms, and the sensory nerves, they control the sensory function, and if these are affected, you have tingling, numbness, or paresthesia, and strength is controlled by the motor nerves. And this is our shoulder. You can see the shoulder joint. It is in the socket, and it has a rotatory function, so that we can move our arms, make a 360-degree turn. This is our clavicle, which establishes our spine, and here also you can see the same things in the left upper extremity. Now I will discuss the other portion of the neck. Here you can see our spine. There are 7 cervical vertebrae. First and second atlas and axis, it helps in rotation of the skull on the neck, and the rest 5 below, they help in the movement of the neck side to side and above downwards. You can see small holes. Through this the nerves come out from the neck. These are in the intervertebral, through the intervertebral foramen. These are the facet joints, and here you can see the intervertebral disc in between the vertebral bodies, and this disc outside, there is strong fibrous tissue, and in the middle there is nucleus pulposus. Sometimes the degeneration, the nucleus pulposus can go back and put pressure on the nerve roots. This is the spinous process. All the structures, they are very tightly attached to each other through ligaments, and there are a lot of muscles which helps in keeping the strength of the neck and also movement of the neck muscles. So we have muscles, we have nerves, and we have disc, and there are ligaments, anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum, and different ligaments, muscles, which establishes the strength and stability of the neck. Now I will be discussing on the spinal cord is in the spinal canal, which is within the it is encircled by the vertebra and vertebral body. This is the spinal cord, which it arises from the brain and continues downwards up to the L1 and L2. These nerves, they come out from the spinal cord, and there is in the front and back two nerves, and they join together, and this comes through the nerve intervertebral foramen, and once it comes out in the axilla, it forms a plexus, and these nerves are responsible for maintaining the motor function and sensory function of our upper extremities or hands, strength and sensory function. So if these nerves are affected, we get weakness in the limbs, and we also get sensory impairment. So this is the brief description of the anatomy of the neck. Thank you very much. Now I will be elaborating on some important causes of neck pain. Neck pain actually affects people who are more than 50 years or above, and it is mostly because of degenerative changes, but it also can affect people who are younger and acute neck pain, and these are mostly benign disease, and it is called non-specific neck pain. And the other causes of neck pain are because of aging. With aging, our structures in the neck, it undergoes degeneration, as I mentioned in my anatomical discussion. So the disc, intervertebral disc, and the surrounding spaces like the spinous process, the facet joint, and the vertebra, they undergo degeneration, and this degeneration causes pressure on the exiting nerve, and people have neck pain, and so it is very important. So cervical spondylosis is a very important cause of neck pain, and also it can be because of other reasons. It can be because of bone disease like osteoporosis, osteopenia, osteomyelitis. It can be because of different types of rheumatological disease like rheumatoarthritis, polyarthritis nodosa, and others. And young people sometimes can have ankylosing spondylosis, which affects the vertebra, and also sometimes Paget's disease. So it can be because of so many reasons, and sometimes patient can have infection of the vertebral bodies, which is called osteomyelitis. It also can be because of certain cancer, and it also can be because of some TB or any other disease. So there are so many reasons for neck pain. Next, I will discuss why we have non-specific neck pain. Non-specific neck pain is the most common cause of neck pain. It affects mostly people who are young, and suddenly they have acute onset of neck pain. It is because of certain strain or sprain on the neck ligaments or muscles, and these are self-limiting. It can last for days or few weeks, and these are mostly benign, and patient overcome this condition over time with some conservative management. And mostly we don't see the degenerative changes as I elaborated earlier. Now I'll be discussing on the posture. Posture is a very important part to prevent neck pain. Sometimes when you are sitting, our eyes should be when you are looking at the computer, our eyes and the computer level should be at the same level. But if you are bending our neck back and forth too much, moving side to side, it can cause neck pain. And weight lifting also puts a pressure on our neck muscles. So we should not lift too much heavy weight, especially if somebody has neck pain which is acute or chronic. He should not be lifting weights more than 1 or 2 kgs to relieve from neck pain. So cervical spondylosis is actually, as I mentioned earlier, is a degenerative change which happens in the spine because of aging, and there is degeneration of the disc and also the vertebral bodies, and it causes pressure on the exiting nerve root, and this pain can be radiating from the neck to the back of the head, shoulder or upper extremities. And depending on the level where these degenerative changes occur, patient can have a symptom. So what kind of symptom we have? Actually, patients with neck pain can have different kind of symptom. They can have pressure-like sensation on the neck, or they can have pain. This pain can be on the back of the neck here, and it can be mild, sometimes moderate, sometimes severe. It can be sudden, acute onset. It can be dull aching pain, or it can be different intensity of pain. Sometimes there can be stiffness in the neck, and sometimes there can be tingling, and this pain from the neck can radiate to the along the shoulder to the shoulder joint, and sometimes it can come to the upper extremities or hands. This pain can be there can be tingling, numbness or paresthesia. These are the sensory symptom. And sometimes because of severe pressure on the exiting nerve root, patient also can have some weakness in the upper extremities. This neck pain sometimes can radiate to the back of the head, and sometimes on the anterior chest wall. So sometimes we can confuse this pain with heart attack. And sometimes this neck pain can be more serious. That means there are certain things which make us think whether there is some serious reasons for neck pain. Some of the symptoms are when the pain is persisting, it is moderate to severe, and patient is having a weakness in the upper extremities with severe tingling and numbness, and patient is having difficulty with walking. He cannot hold his urine or stool, and all these are very bad features that this is a serious problem. And sometimes if somebody having fever with the neck pain, we have to investigate whether patient is having any infectious cause of neck pain or any joint pain associated. Could there be any rheumatological causes? If patient is immunocompromised, like HIV, IV drug abuser, we should be concerned. And if patient has cancer in any part of the body, sometimes it can spread to the neck. So these are the few symptoms when we should be concerned that this neck pain could be serious, and most of the time the acute neck pain resolves within days or weeks. But if it persists more than 4 to 6 weeks and becomes chronic, then we have to take this more seriously. And sometimes this pain can be intermittent. That means it can last for initial few weeks, and then it resolves and it can come back and forth. So we have to follow up with the neurologist frequently. And to diagnose neck pain, we have to do certain investigation to confirm the problems. Actually, most of the time we take a nice history from the patient about the neck pain, and if it is benign, we don't even investigate. We keep some conservative management, and patient improves. And if the pain is not resolving or persisting, then we can do some blood test to look for any infection, inflammation, or any kind of rheumatological disease. And after that, if it is, we can do for some neuroimaging studies like MRI of the cervical spine, which shows the different structure of the neck very well. We can see the vertebral bodies, we can see the disc, we can see the spinal cord, the amount of herniation, degeneration, whether there is any malignancy. So a lot of information can be obtained by doing an MRI. If it is not possible, if patient cannot tolerate or there is contraindication for MRI, then we can go with the CT scan of the cervical spine, which is gives us some reasonable information. Sometimes we can do plain X-ray if it is very benign neck pain, so we can see these vertebral bodies, and we can see the we can see the vertebra, but we cannot see the details of disc, but we can get some information. But most of the time MRI is the best test. Sometimes we can do myelogram, CT myelogram or X-ray with myelogram to see the details of the spinal cord relationship with the disc. So sometimes we can do bone scan if we are suspecting some metabolic disorder is there, like fracture, or if there is any osteoporosis. So these are the few things we can do. Regarding the treatment, as I mentioned, non-specific neck pain, these are mostly benign. It can be resolved with some conservative management. So we can give some analgesics, patient can get some cold compression and some rest and some muscle relaxation. It will be resolved over time. And but if the pain is more severe and patient has other diagnoses like cervical spondylosis, which is again of different types, we can give some conservative management, like we can give some medicine like painkillers, we can give muscle relaxant, we can give like pregabalin, gabapentin, etc. to relieve the initial symptoms for days or weeks. And besides medicine, patient should take some precautions for his neck pain. He can use the cervical collar for some time or intermittently. He can do some exercises to prevent the neck pain. And if it is not resolved, he can go for physical therapy for some time, maybe 2 to 3 weeks, which can include ultrasound, shortwave, infrared, or TENS, or in some cases traction. So the physical therapist will decide on the mode of treatment in that case, and patient also should follow certain restriction. But when the patient having recurrent pain and it is not relieved and the symptoms getting worse, sometimes the conservative management does not work, and if we do the MRI, there is significant disc herniation sometimes, or signs of myelopathy or severe cervical stenosis. Patient needs surgical treatment and he should be referred to a neurosurgeon. So most of the time these surgeries are done by the neurosurgeons very well. It should be by a good neurosurgeon with expertise in this field. And so prognosis of neck pain is different. So most of the time, as I mentioned earlier, this pain is mostly benign, specifically non-specific neck pain. This affects younger people and it can last for days or maybe few weeks, and it will be resolved. And a lot of times they don't recur or come back. But sometimes, if it is the pain is moderate to severe, and it is not resolving over a few weeks, then we should be more concerned and we have to investigate what is the reason for this neck pain, and according to the situation we have to deal with this condition. And in some cases this pain becomes serious and patient has some advanced neurological sign symptom like weakness in the arms and legs, and he cannot walk, he cannot hold his urine or stool. In those cases patient might need some surgery. Regarding the role of prevention of neck pain, we have to do certain things. I mean, we should maintain a good posture when we are sitting, when we are doing desk work. The desk should be high. We should not bend our neck too much, and so posture is a very important part. And if we are sitting in a car or sitting long, we can put some rest on the back. And also, if we have neck pain, sometimes we can use the cervical collar for very short periods when we are traveling long distances. And also we have to keep our weight under control. This is also very important. And we have to eat healthy food containing a lot of vitamins, vitamin D, calcium, so that we don't develop osteopenia or osteoporosis, which can happen with aging. So these are the few preventive roles which should be taken so that we don't develop neck pain. So this was a brief discussion on neck pain. Please look at the video below to see some link of neck exercises which are helpful for patients. Thank you.